Good afternoon, and thank you so much for joining us today. My name is Ashley Mangum, and I am the program manager for pediatric mental health at Marybridge Children's Hospital. And I get the luxury of working also as the program manager for Kids Mental Health Pierce County. If this is your first time joining us today, welcome. If you're not familiar with Kids Mental Health Pierce County, we are a community coalition of people and agencies in Pierce County that have joined together to address the growing behavioral health crisis among school-age children and youth. We are dedicated to developing a coordinated and responsive behavioral health system that serves the needs of children, youth, and families at the right time in the best place and with the best outcome for every family. These webinars have been something that we did early on the onset of the pandemic as a way for us to get together as a community to talk about resources and supports available within Pierce County. Today, I'm so happy to facilitate today's webinar where we'll be highlighting a Pierce County agency, Developmental Disabilities Administration, better known as DDA, today to highlight their services and just to learn more about that organization and how we can best collaborate as a community. A second goal for today is to provide a forum of community support where we can learn from each other. We have the opportunity for questions and answers. So there is a Q&A button at the bottom there where you can ask your questions throughout today's presentation. We will do our best to answer them. And if we're unable to get to your question, we will follow up with you after today's webinar. Because we do have limited time, I do ask that we not ask any case-specific questions and that you submit those questions via email, and I can forward them to our panelists who may be able to assist with your specific needs. Again, since we are providing this form of community support, I also encourage you to introduce yourself in that chat box. Let us know who's here today, if you're here, if you're part of an agency or you're a parent or somebody working with students or different people in the community. Share that with us so that we know who's here. And again, feel free to share your expertise and any suggestions that you have as well in that chat box. So today it's my pleasure to introduce our speakers today and highlight again our Pierce County Agency Developmental Disabilities Administration, usually known as DDA. And DDA is a branch of the Department of Social and Health Services. DDA spans services for qualifying individuals from birth to end of life. Their mission is to transform lives by providing support and fostering partnerships that empower people to live the lives they want. So today we are very fortunate to have local members of DDA that will be presenting an overview of DDA intake, eligibility, and services, how DDA partners with other community resources, and then again, that opportunity to answer any questions that come up today. It's been a great partnership and collaboration to have DDA participate in Kids Mental Health Pierce County. They regularly participate in some of our multidisciplinary team meetings when we have just really complex needs and have been just great community partners in being that resource. So today it's my absolute pleasure to introduce Terra Jacobson, who is the Field Service Administrator for Pierce County. She also serves on the Kids Mental Health Pierce County Steering Committee and often participates in those MDTs. Also, we have Destinie Buzzard, who is the Supervisor for DDA Intake and Eligibility, and Maria Bellarts, who is the Supervisor for DDA Intensive Children's Program and the Regional Coordinator in DCYF Liaison. So again, thank you all for joining us. Use that Q&A box, use that chat box. This is a community coalition and we're here to support each other. So at this time, I'm going to turn it over to Terra.
Hi, thank you, Ashley, for that wonderful introduction. It is nice to see all the names in the chat. Thank you guys for taking the time out of your busy day. I know you guys are all super busy in the work that you do, and we're hoping for the next hour and a half in time that we have together that you learn a little bit more about DDA. You have some faces and names maybe to reach out to, or we're able to answer any questions or provide clarification to things that have been kind of sitting on in your head or shoulders about how you can partner with DDA for the individuals that you serve. So again, my name is Terra Jacobson. I am the Field Service Administrator with Developmental Disabilities Administration for Pierce County. We today, like Ashley had mentioned, we will be going over our intake and eligibility process, which is kind of a two-part process that can be kind of cumbersome. We hope to bring it to more everyday terms to let folks know what that process looks like. And then we'll be talking a little bit about how we partner with community resources such as yourself, and how we hope to continue to partner in providing supports for kiddos that we all find so near and dear to us, and trying to just help improve the quality of life for them. So Maria is our DCYF Liaison, but also oversees our intensive kids programs, and is also just a coordinator for us internally to make sure that we are all on the same page with how we can best support kiddos who are receiving services from Developmental Disabilities Administration. So for today, just a quick overview of what you guys can expect from us today is we'll be providing an overview of DDA. If we went into what DDA services are, waiver services, we would be here for multiple days, and there's just a lot to what DDA can provide. Out of all the DSHS agencies, we are the ones that do provide supports from the time of birth all the way until people choose no longer to have services, or until death. So we span many years, many different places in people's lives, and different times of different resources. So there's kind of complex services that are offered. We will be answering questions. So as Ashley mentioned, there is the Q&A portion. We highly encourage you guys put your questions in there. There is no such thing as a dumb question, because if there was, I'd be asking those all the time. They're good questions, no matter what they are. And typically, if you have it, somebody else has it too, and we'll provide clarification. As we go through today's overview, we'll also be, we're hoping this is helpful, we're going to be cutting and pasting some of the links to our DDA intranet, where you can find resources or services that we're speaking to. So I encourage you, if you are at your computer, copy those down, save them to a Word document, or, I mean, if you're super savvy, not like me, but if you're super savvy, go ahead and put them into your browsers and save them as your favorites, because they're ones that we refer to. There's resources that we use, and they'll hopefully pair nicely with the overview that we give today. So, so look in the comments or the chat section for those different links that we will be posting. What we do ask is, as we go through our overview today, we're not really going to be doing case staffings, if you will. So no specifics. We're not going to be able to put a lot of focus on individual needs or individual questions, because just like what DDA does in terms of what our vision is we're really person-centered, and we don't want to give too many specifics, because we'd want to know more about the individual in order to really provide more specific conversations or feedback or resources or supports. So if you do have a specific individual in mind, or really specific questions, we at the end we'll post in our email addresses for you guys and our contact information, and we would be happy to staff or have a case staffing with you at a later time. Today is really more about the bigger picture conversations. So we have those. Also, so what we're going to do is, right now, we're going to start with the mission, vision, and values of DDA. So I'm going to share my screen. And all right, does everybody see that?
Yes.
Okay, good. Thank you. Thank you. So this is our internet, or excuse me, our intranet. But mission, vision, and values is what you guys maybe have heard, but I'll just go over it again, is we're really about transforming people's lives. We want to provide partnerships with individuals and their support system in their community, and empower people to live the lives that they want. Not that we want, or not that family members want, but the lives that they want. Really empower the individuals we support. Our vision is kind of composed of supporting individuals to live, contribute to, and participate in their communities. Continuing to improve supports to families of both children and adults. Individualizing supports that will empower individuals with developmental disabilities to realize their greatest potential. So when we talk about individualized supports, it's really about that person-centered piece. Building support plans based on the needs and the strengths of the individual and the family. So we want to look at what's their motivation, what are their strengths, what drives them, and how do we complement that with the support and services that we do have. And we want to engage individuals and families, their community members, who's involved in their life. Do they have jobs? Who are the stakeholders in their lives? You guys that are involved with individuals. How are we engaging everyone? Our values, respect. It's really about the respect, mutual respect about the folks that we serve. Person-centered planning. I can't speak to this enough. Is what's good for one person may not be good for another person, or may not be of value to another person. We're really looking at the individual and what drives them. What do they want? Partnerships, again, it's kind of that wraparound model, but without the formal title. Sometimes we're really looking at how a community supports one another. And then community participation. We want to encourage our folks to be contributing members to their community. So I'm going to go ahead and stop my sharing and see if there's any questions I want to touch on before we move on. Will the screen materials be available for us? Yes, and we will copy down the links. I will copy down one link that I'm going to put into here right now. This one is a really great, oh gosh, it didn't link. It didn't link, you guys. Well, don't worry, we will come back to that. But that is it's a pamphlet about the guide to eligibility, supports, and services, and it kind of goes over the mission, vision, and values. Next is, if you guys, I want to see from you guys, and go ahead and put this in the chat section. Have you guys, is anybody aware of Gov Delivery, or has anybody heard of Gov Delivery? Thank you, Ashley. So no. Yes. Okay. No. Okay. Well, I guess that's a good place to start. So Gov Delivery is really great. I will again share my screen to get. Let's see. Hold on. Okay. So I'm going to share my screen one more time, and make sure. Okay, so hoping you guys can all see that. So this is our internet. This is our main page of DDA, and there's a lot of different links through here depending on what your question is, and we'll take you to different locations, again, depending on what your questions are. But if you go to our main page, and again, we'll copy this into the comment section for you. If you scroll all the way down, there is this piece right here. This is Gov Delivery, and you can sign up for news and updates and they're not all specific to DDA, but you can, you click in here, you put your email, and it has you go through multiple questions of what type of information you would like adult family homes, residential services, kids supports. And you can kind of tailor, you can get Department of Health updates, you could get DSHS as a whole updates, or you can have it very streamlined to just DDA. I encourage people to fill this out, get connected, come straight to your email, and it's really a wealth of information coming your way about latest or updates to services. I will stop that as well. Thank you, Ashley. So Ashley went ahead and put that in the chat. Again, another really great place. And if you find out that you start getting just a flood of emails because you've clicked every box, you can always go back and tailor it to the information that you would like to know. All right. So that is a bit of my overview of DDA. Again, what I want to make sure that I really focus on, I think I have, is that we're really person-centered in the supports and resources that we offer. We want to empower individuals to live the life that they want. Some little notions I'd say that people think that DDA does, we can't make people participate in our services. We can't put expectations that people participate in our services. all DDA services are voluntary for the individual. And the individual would, if they're their own decision makers, that is who we are working with to find out what they want in their lives in terms of support and services. If they, for whatever reason, are not their own decision maker and they have a legal guardian or a durable power of attorney, depending on their capacity, we would work with them also, but we're still focused on the individual that we serve. So we want to make sure that we are offering services, and it is ultimately their choice, their decision, if they accept it or want to participate in. Also, DDA isn't necessarily a crisis service. We don't, years and years and years ago, there was a little bit more movement, I would say, of when folks would seek out in terms of crisis, that there were more opportunities, especially kiddos, for residential habilitation centers, which are also known as state institutions through DDA. There's been laws that have changed since 2000, I believe it's 11, that kiddos aren't able to go, and even younger adults, it's not really an option unless it goes through much higher, and it's shown that people have been exhausting other options of supports that they have benefits, which would be state insurance, mental health organizations, behavioral health organizations. We want to make sure that people are utilizing, accessing their benefits as a right, as a human being, as a person. So DDA, sometimes it used to be seen as more of a crisis, but we were more at a preventative, partnering, voluntary service for people to live the lives that they want. So I'm sure you guys are all curious on, okay, so if somebody potentially could get DDA services, what is the intake and eligibility process? So that will lead me now to introduce Destinie Buzzard, who has been a phenomenal case manager through years, has been a supervisor for the last several years, and is our intake and eligibility wealth of knowledge, wonderful resource for DDA. And I believe she'll be able to provide a lot of resource to you guys as well. So thank you for your time, and Destinie, it's all yours.
All right, hello everybody. Hope you're all doing well today. I'm going to get my screen share going. I do have a PowerPoint as well as a few things on our external internet site that I will take a moment to share with you as I go through. And let me make sure that I can see everything and nothing's going to disappear on me. We'll go over a brief overview of our intake and eligibility process here at DDA. This is kind of just the off-the-cuff nuts and bolts. We don't go into a huge rule or taking apart the Washington administrative codes that we follow with this PowerPoint. However, if anyone is interested in looking at that, I'm more than happy to share those WAC numbers so they can go through and look through it and go over any questions that come up with that. But in the meantime, we'll go ahead and get going with this. So we're going to talk a little bit today about what DDA eligibility is and how the process works. We'll talk about the difference between being eligible for DDA and being eligible for waiver services. We'll briefly touch on what the 5 waivers are and do a little bit of looking at some of our fact sheets for some of the services that can be provided on there. So number 1, to be a client with Developmental Disabilities Administration, you have to have a developmental disability. This criteria is outlined by saying that it must originate before the individual turns 18. It needs to continue or be expected to continue indefinitely, and it has to constitute a substantial limitation to the individual. And each criteria we have does have specific criteria. I'll show some of that a little bit later in here, but there are specific numbers basically for testing that we look at and specific need that we look at to qualify for a substantial limitation with DDA. So some of the categories that we can make someone eligible under is that their disability has to be attributed to would be an intellectual disability, a cerebral palsy, epilepsy, autism, as well as we can look at other neurological or other conditions, but they have to be found to be closely related to an intellectual disability and that requires similar treatment or care to those who have an intellectual disability. And we have a long list of those. We are always bringing in new conditions that we were not aware of and having those reviewed to see if they can be added to our list of eligible conditions. And in order for somebody to become a client, the first thing we have to do is we have to receive their application. So it's submitted either by the client or their legal representative, which oftentimes is a parent or family member. There are 4 forms that we send out with a eligibility packet if someone requests it. However, only 3 of them are required to come back. So the main one is the request for DDA eligibility determination. That's going to be the general demographics, their name, their address, who their representative is, kind of just those bare bone pieces. The next one is going to be our consent form. This is probably the most important document after the actual request for a determination, because this is the form that is used to allow the intake staff to actually request documentation and get the information that we need to confirm diagnoses or to show substantial limitation. And I will show that form a little bit later, just because there's a couple of pieces to it that we always try to make sure that families know before they fill it out. The last form that we have sent back is our Notice of Privacy Practices. This is the basic HIPAA form saying that we will not share anybody's information unless they ask us to, and only with the individuals that they say we can share information with. In addition to those, a person needs to be a Washington State resident. As I said earlier, we need to be able to get evidence that they had onset of their disability prior to age 18. They have to have a qualifying condition, and again, they have to have that substantial limitation. We go through the process of reviewing all of that different documentation that we receive, and then when we are all done, we do send out a notice. It's called a planned action notice that shows what the decision is, and it goes to both the individual who applied and to whoever they marked as their representative. Here's the big question. How long does a determination take? So DDA has 30 days from the date of receiving the last piece of information that we need, that we have requested before we make a determination. If we have insufficient information to determine if you are eligible, and we haven't received the documentation that we've requested, we may deny your eligibility up to 90 days. We do try to work with people though. So if people are calling us and we know testing is about to be done, or we're waiting just to get an update to something, and we've talked to the psychologist, we've talked to the neurologist, whoever it is, they're working on getting it. We will work with those families to make sure that we can get that information in. That being said, if we get that piece of paper on day 90, we do have that 30 days after that. So you could be looking at up to 120 days just to get through the eligibility process if we're having a hard time getting our paperwork that we need to show the substantial limitation. And thank you, Doreen. It looks like Doreen has shared a resource from PAVE also in the chat that has a little video on how to do this process. So this is a little bit more into that documentation I've talked about. Again, we have to have a diagnosis of an eligible condition depending on the eligibility category. Different professionals have to give that diagnosis, again, before age 18. And some of the types of substantial limitations that we look at would be their IQ scores, if they have physical assistance needs, as well as their adaptive functioning test scores. So the next big question is, well, once I'm a client, am I a client forever? Not necessarily. So if somebody becomes eligible and they're in an early intervention birth to 3 program, their eligibility does actually expire on their 4th birthday. If somebody is made eligible after age 4, but before age 10, under the category of developmental delay, again, their eligibility will expire on their 10th birthday. We also do have a program that it's not as big as it used to be, but our medically intensive children's program. If somebody is qualified under that program, they expire on their 18th birthday. And then if we have someone who their current eligibility determination was made off of specific school testing from the broad reading or broad mathematics testing, then we would need to review their information to make sure we've got a qualifying IQ score that would replace those broad reading and broad mathematics scores before their 20th birthday. We also have reviews if somebody is made eligible before they are 16. We do one more review between their 19th and 20th birthday just to make sure that we have everything set and ready to go for them to move forward into their adult services. And then if you leave state, if you move out of state with no plan to return in the near future, then we will end your DDA eligibility. And one of the reasons we do this is because a lot of times if someone has eligibility here, they will also need eligibility in the new state, and you can't have it in both. So we terminate the eligibility in any services here in Washington State so that those can be started in wherever the new state is. Anytime we have someone who is expiring, that previous slide, those age 4, age 10, age 18, we give a 6-month notice. So 6 months before the person's birthday, the family, the client and their representative will get a letter in the mail saying, hey, you got to reapply before their birthday. This is happening. Again, 2 months before their birthday, they'll get that formal planned action notice that basically is just saying, hey, this is really going to happen. It's going to end, and we need you to reapply. Otherwise, their eligibility will go away. So we try to make sure that people have lots of notice of that before we end any services. So you get through the process, you're now DDA eligible, you just get services, right? That's kind of the big myth. For us, there's actually more layers. So becoming a client, that's just layer 1 of eligibility, showing you have a qualifying condition and substantial limitations. And able to get a program, whether it's personal care or a waiver, we have to have the person be both financially and functionally eligible. So our financial eligibility is through our long-term care. That is basically saying that they are eligible for Medicaid and they have a Social Security disability determination, meaning that they could be eligible for Social Security. Long-term care goes through and does all of that. That eligibility is not done by DDA. The second piece, that functional eligibility, that is done by us, and that is the in-home assessment. So where the case manager typically comes out, right now doing it through virtual means because of COVID. They go through, they do the assessment, and an individual has to meet, it's called Intermediate Care Facility for Individuals with Intellectual Disabilities level of care. A lot of times you'll hear us shorten that down to an institutional level of care. And this is determined by our care assessment. Okay, so the next piece, we get through that. We're financially eligible, we're functionally eligible, we're a client of DDA. What can we now do for you? So I mentioned earlier, we have our personal care service. That's not listed on here. It is a Medicaid entitlement service through a program called Community First Choice. And that covers a lot of our, your personal care, your ADLs, activities of daily living. So your hygiene, your teeth brushing, shopping, all of those types of things. Our 5 waivers are individual and family services waiver, our children's intensive in-home behavior supports, or our SIBS waiver, our basic plus, our core, and our community protection. The waiver we see most often, especially when we're working with kiddos, is our individual and family services waiver, just because that one is only available to those who are living with their family. And clients who are on a waiver, they can only be on one at a time. So we can't be on multiple waivers at once. All right. So we are going to do questions a little bit later. So what I'm going to do is share a little bit of these documents. Some of the links have already been shared. So this is our eligibility website. So if somebody were looking to get the documentation, you have a printer or you're able to fill out and sign documents online, those 4 documents are right here. So we have our eligibility determination. Like I said, I'm going to show you guys real quick the consent form, because the very first one you're going to see on here is the large print. Most medical professionals will not accept that version because it is about 4 or 5 pages long, and it is too difficult to tell if the person requesting it is that the next pages belong to the same person. So they don't like to accept that one. So we always ask people drop down here to one of our standard versions. It comes in multiple different languages based on the family you need. And then when we're filling these out, there are check boxes here that need to be filled out, as well as we need information written on the line. So if you mark all healthcare providers, without knowing the name of the doctor's office or facility that we need to get records from, we have no way of finding out who those people are. So it's really important that both the box is marked and the contact information is on here, either the name, the fax number, phone number, whatever information you can get us. A lot of times people will also attach a second piece of paper with that information for us and just write "see attached" on the line so that we know that there is an attachment. When working with kiddos, even though we know the parent is the legal guardian and they're the ones that sign everything, if a child is over the age of 12 and they have the ability to sign, we do like to get their signature on the consent form. The reason for that is some places with mental health records, they don't like to release it unless the child is also consenting. And for them, the age of consent is age 12. And for some of them, autism does technically fall under the mental health category in our DSM, our Diagnostic and Statistical Manual. So some of those providers will ask that a child sign their consent form as well over the age of 12. Go back here. That 4th form I talked about earlier, the one that I said we do not need back, this is what I call our quick and dirty cheat sheet. So this is going to go through and show you the age categories and what type of condition someone can qualify under. The reason we have this is because developmental delay has different criteria for birth to 3 than it does to 4 to 9, and then is not an accepted condition after age 10. It goes through and talks about what are our cognitive tests. These are going to get you your IQ scores that we use. And it lists some of the tests that we are able to take, both the verbal as well as some for those who are nonverbal or hard of hearing, or do not have English as a primary language. It also has our adaptive assessments that we accept. And then if you go down to page 2, this is where you really get those meat and potatoes. It's going to have each of the categories. It's going to say who we can accept that diagnosis from. And then it's going to say, what are the substantial limitations? So what are those tests? What are those numbers that we're looking for somebody to be able to qualify under that condition? And you'll see they do differ from condition to condition as to who can do it, make that diagnosis. All right. One of the other links, it looks like Terra just put that in, is to our fact sheet. That will take you to this page. It has a lot of different information. You will find our waivers on here, our Basic Plus, our SIBs, Community Protection, Basic Plus, and Core are all in here. And I've already clicked on a couple of these, so I wanted to show that Individual and Family Services waiver real quick, just so you can kind of see how these work and read. So it's going to talk a little bit about the history of the waiver. It's going to give those eligibility requirements. So again, it's going to talk about, are you a client with DDA? Do you meet the Social Security criteria? do you meet that institutional level of care? So that is where we do the assessment to find out. The Apple Health, that is the Medicaid eligibility. So it'll go through and talk about that information. And then down at the bottom, this is our menu. So with all of our waivers, they have this menu of services. And just like at a restaurant, you get to go through them and find out which one of those will work for you or your loved one. And whoever is doing your assessment can get you more information. A couple of these are also on our fact sheet list. You can get a little more information on some of these. Otherwise, more information can be found from the case manager who does that initial assessment. So that goes through. For this particular one, it also talks about this comes with a level of funding. Depending on how you are scored in the assessment, you'll get a different level of funding for this waiver. And that's the amount of money that you have for a year to spend on these different services. The rest of our waivers work a little bit differently. So when you go through and look at that, it'll talk about the different ways that those waivers work. The other program I just want to take a quick moment to look at is that Community First Choice. This is that Medicaid entitlement program. So if they're on Medicaid and are financially eligible and they meet functional eligibility criteria, they can get into this service. And the main one we have on here that we use is personal care. However, there are a few other pieces on here that a person can access with that program to get some supports in their home to help them out to live the life that they want to lead. And again, it's got the list of eligibility criteria on here and a little bit of history about the program. All right, so I'm going to go ahead and stop sharing there. So that is our intake and eligibility program here at DDA. And we will work on getting to questions at the end. I'm going to go through and start reviewing questions now. So when we get there, we'll be ready to go. At this point, though, I am going to hand it over to Maria so that she can share a little bit more about our services and our kiddo program.
Hi, good afternoon, everyone. So glad that we're coming together to talk about how DDA partners with our community partners. That's what I am going to be covering. And I'm going to share my screen going back to our DDA intranet. Can you all see my screen?
Yes.
Thank you, Ashley. So here, I want to just start out with, when you go to our website, you can scroll down just a little bit here, and off to your right side, you'll see programs and services. So when you click on that, it'll bring you to this page. And right about here is what we're going to first talk about. When a person is DDA eligible, our focus is person-centered. So we're looking at and engaging with that individual. What are their goals and plans? What are their topics of interest? And in here in our website, we have our person-centered practice resources and information. And you'll see here there's 5 videos that you can click on. Has an introduction, an overview of our person-centered values, the tools and approaches, our person-centered approach to the assessment, and the person-centered service plan process. And then part 5, the conversational and assessment style planning. So what does this all mean? After our presentation, I encourage each and every one of you to click on those videos and really take the time to look at what we're discussing in more detail. But what this means is our assessment tool, though it's called CARE, it in all of our documentation and the way that we talk about our tool is person-centered service plan. And the way we begin that plan is by engaging with the client, the individual, and if they're not able to make known their goals and plans and interests, we speak to their family members, parents, and anyone else that's knowledgeable and participating in that assessment. We ask them what their skills and gifts are. So that will be how an assessment starts out, is going through that section with them and documenting that in first person language. So my skills and gifts are maybe that I love people, that I enjoy a comfortable home, and how best to support me is to make sure that I have round the clock care. What doesn't work for me and what does work for me? What's important to me? Maybe it's family, maybe it's safety. My relationships and interests. My perfect day includes a hot tub or movies, music, or chair, sitting in my chair. My favorite things, what makes me happy. And goals in the next year. I really want to make friends and have a safe housing transition. That could be some examples of how we make our interactions person-centered. Another part of the same section of the tool is to go over our topics of interest. And if there's a category that's selected, for an example, community integration, how do we want to utilize the services that are offered under one of the waivers that Destinie talked about in meeting that interest that our individual has. So that is what goes into the approach here as we talk about the tools and the approaches of our person-centered practice. And then all the documentation that is received by the individual and their NSA, and NSA means necessary supplemental accommodation. When they're under age 18, that's going to be the parent. When they're over age 18, it's whoever the legal decision maker is. That brings us to our next topic. Individual decision making. Who is the decision maker? When we have a person who is under age 18, it's the legal parent who has the legal decision-making authority. We have parents who are married, and both parents retain legal rights to make decisions. There are parents who are divorced, and per the divorce decree, there is a parenting plan in place. And it may be that they share legal decision-making authority. It may be that only one of them has that. So DDA looks to that documentation to determine who has that legal decision-making authority. When a youth turns 18 years old, they are considered a legal adult. And at that time, we really want to look at who has legal decision-making authority. Is it the individual themselves, or is it someone else? So the question really begins with our individual, who the person is, and do they have the capacity to make a decision? Now, capacity is really a fluid word. It means a lot of things depending on the situation. So in our situation, what we're looking is to whether they are able or have the capacity to make a decision about DDA services. Are they able to make a decision to sign themselves into services as a legal adult? At times, this can be a confusing point because it's not as common as folks may be making a decision based on healthcare decisions. And what can happen is people may think that
DDA operates on the informed consent statute, RCW 7.70. However, that statute does not apply to DDA services. It only applies to medical providers, and DDA is not a medical provider. So therefore, using the informed consent statute would not apply. And so going back to the individual, some questions that we could ask about the individual is, can they or are they able to direct their self-care? Are they able to convey that they have a problem? Is the individual aware of the consequences of their decisions? Now, this does not preclude an individual from making a decision that may have negative outcomes or outcomes that, or making decisions that we wouldn't necessarily make if we were them. The ability to communicate doesn't necessarily mean that they, if they can or cannot communicate, is really a gray area. So many individuals are able to communicate verbally. Others are able to communicate non-verbally. Are they able to make their decisions and desires known in such a way that it's understood? If they're not able to communicate typically verbally, they may be able to write it out, or if someone is explaining to them what their services are, and then they're able to understand with some support, they may not need guardianship. However, if the person is not able to direct their self-care, they're not able to make decisions as, for an example, signing a lease for an apartment, or signing up for a credit card, or agreeing to a marriage. Those are the type of examples that, as a legal adult, if you're able to make those decisions and understand the consequences of them, then you wouldn't need a legal guardian. But if you're not able to, then petitions for guardianships would be in order. And the petition for a guardianship includes very specific information, factual information about the time card itself. Excuse me, I was reading that, about the individual themselves, that's in the petition for guardianship. Let's see. In the case where an individual who is a client is not able to provide consent, we do encourage family or friends to explore other options, including seeking guardianship. The guardianship process may take 6 to 8 months, even longer, to establish. And DDA as an agency doesn't provide other entities with legal advice. So we really leave that up to the individual's caregivers or other people who are involved in their life to consult with their attorneys. All right, so the next portion is talking about the Healthcare Authority, HCA, and children, Washington State Healthcare Authority. And this is the website where we would be looking at information with regard to Apple Health. We partner with the MCOs, the Medicaid care organizations, and there are 5 that are contracted to cover the entire state of Washington. And here at this website is information regarding how to apply for Apple Health coverage, the enrollment, next steps, healthcare plan finder, and information here on how to apply for this. Back with what Destiny was discussing, financial eligibility. That financial eligibility is Medicaid eligibility. And so all DDA eligible youth are Medicaid eligible, and so they will be assigned to an MCO. Most typically, we have Molina. We worked with AmeriGroup, United Healthcare, Coordinated Care, and forgive me, I can't remember the last one. But they provide services and pay for services including speech and language therapy, ABA therapy, and we ensure that whatever waiver services pays for is not covered under the Medicaid insurance plan. Because we're both funded through the same funding source, we don't want to double dip. And I noticed the time is 7 minutes till 4 o'clock. So I'm going to go through the next portion here. We also partner with mental health, hospitalizations, behavioral health organization, and I'm going to show us all the guidebook for meeting mental health needs of people with intellectual disabilities. This is a lengthy guidebook on how to serve dual diagnosis individuals with intellectual disability and mental health needs. And so we partner with hospitals and other community support partners when a person has a dual diagnosis. This also includes WISE services, and that is another partner. Here's the website for the intensive wraparound services that they provide in the home. I know that WISE's focus is to help preserve the family in the home and essentially prevent hospitalization if that's possible. Again, to reiterate what Terra said, DDA services doesn't provide crisis services for children and youth. And so we would partner with the MCO and the hospital and WISE during meetings, and sometimes those are weekly meetings, to be able to access the appropriate treatment services if needed and appropriate in-home services from DDA. So DDA is a piece of the pie, but not the entire pie. We also partner with the school, and the school can, with DDA, what's more typical is we will have recommendations, letters of recommendations from maybe the speech and language pathologist or the OT-PT therapist, and they may be recommending assistive technology supports. And so we would utilize our waiver services or tap into a pot of money with under the CFC portion to allow someone to become more independent with their activities of daily living. Sometimes what can be an option too is residential boarding school as an option if the person is not able to receive a free education at their local school district. And so that might be another option to explore, and that's how we would partner with the school and the caregivers. So I think I'm going to wrap it up and hand it back to Terra with 4 minutes left to the hour. Thank you.
Thank you, Maria. Actually, I think we're going to have Destiny and myself, we're going to spend some time with the Q&A. There's been some questions that have come up. Let's see. So the first question, why does DDA rule discriminate behavioral health, mental health disorders in its eligibility rules?
All right, well, that is definitely a very big question. So what it is with DDA, because with how our funding is received from the Centers for Medicaid Services, our funding is here to support those with developmental disabilities. So our rule does state that their intellectual or developmental disability has to be due to their disability and not to the underlying health condition. That being said, we have many people that we do serve who do have dual diagnoses, but for the purpose of our eligibility criteria, we have to show that their substantial limitations does come strictly from that developmental disability and not from a mental health disorder. And a lot of that comes from the money that the Centers for Medicaid Services allocates for mental health services are done through other means, through the MCOs in our state.
Great, thank you. And if that didn't answer, you can add a little bit more to the question if you want. So the next question, it kind of pairs nicely with, it says, what can or does DDA do to support individuals in crisis hospitalizations who have dual diagnoses like autism and depression or Down syndrome and schizophrenia, intellectual disability, and bipolar? So when somebody is in crisis and is hospitalized, and this is I'll be speaking to like community hospitals. If I'm misinterpreting the hospitalization, let me know. But again, we're going to come from a point of the case manager that's assigned will be looking at or working with the hospital team and anybody else that's involved. If there's a family member that's involved, or if it's a kiddo, so like if school's involved, we're going to really ask a lot of questions of how did the individual get there? What are they presenting as crisis while in the hospital? What supports do they have? So really it's about looking at the individual. What are they currently experiencing? What's the predominant issue or concern that brought them to the hospital? What's being seen in the hospital? Are there appropriate individuals? Like, do they have insurance involved or a care coordinator involved? They can also look at additional supports for the individual. So it's really person-centered. And then we would be looking at what is this, looking at and advocating for what would be considered a safe discharge. So what appointments would be needed for someone, were their medications changed? So how would that impact providers coming into the home in terms of what level of support they'd be providing? If the person is in residential individuals would be there to talk about, is there environmental supports that could be looked at? So it really comes down to the person-centered piece, but we've had a lot of partnering. Really, it comes down to partnering with the support system of each individual and what supports that they are needing. But most folks that we serve do have dual diagnoses, and that is something that we're trying to make sure all supporting folks are involved with the planning around safe discharge from a hospital. I hope that answered the question.
This is Ashley. I'm just wondering if I could chime in a little bit. I think in Pierce County, we have recognized to have a process that helps coordinate some of these co-occurring needs, knowing that families and youth have multi-system involvement, have a variance of needs, and how do we streamline that process and bring providers together to help put our resources together to really support those families. And here in Pierce County, we do offer a Kids Mental Health Pierce County Community Multidisciplinary Team Meeting. And that's been a great resource where we're able to bring providers onto a coordinated call to really identify what those needs are. And it's a great way for our different systems to get together. We'll say, well, I could support this, or we need this evaluation. So who's going to help support that and really identify those next steps so that family's not navigating that system by itself in a really strategic way for us as a community, again, to come together for our kids and families. And so that is a resource that's able to be accessed by anybody in the community. You don't have to be DDA eligible to participate in that. And you can find more information and a referral form on our website, kidsmentalhealthpiercecounty.org.
That's great. Yeah, thank you, Ashley. And then we have another question, and this is, I may not read the whole because it's a pretty lengthy, and it seems a little specific, but in essence, what the question is are there resources for like single parents who have multiple children, who work, but then are also needing to take care of their kids, who may have developmental disabilities. There's not a strong personal network, so not a lot of help with babysitting. English is a second language. There really needs to be a lot of supports around outside of their county for appointments, navigating social service, making appointments with medical providers. And then the mom is currently receiving support. So with that, you know, how we operate is we typically are operating on the individual that we serve that is considered a DDA client, if you will. And what supports and services do they need or require? We do, depending on this, we do work with translators. We do have multiple documents that are translated. We will try to make it, we'll work also with the school. We work with the, again, the care coordinator, depending on the level of or the waiver that an individual is on. We might be able to look at different ways of like, some of our waivers have like staff and family consulting, which would allow opportunities. Well, it's not that called that anymore, but the habilitation services, really providing supports to the parent to provide supports to the kiddo. This question kind of sounds like it's like, it sounds like mom has a lot on her plate, and bless her heart. She's got a lot going on, and it's like, how do you find support for the caregiver? So a lot of times we work with like PAVE or PC2 to, oh, look at that, to kind of connect parents to parents, to figure out the best ways to provide support. So Doreen put that in the chat right as I said it, so we must have been on the same page there. So that's absolutely a resource that we would be recommending. Another question is there financial services for a parent who wants to be the full-time caregiver for a DDA eligible child? If the financial services for a parent, so I'm guessing that means like, could the parent be a paid care provider, an individual provider? That's how I'm interpreting that. If I'm wrong, please add to the question. But if a kiddo is under the age of 18, in Washington State, parents are not able to be paid individual providers for their child. Over 18, they have to go through the typical contracting process for that. So if I'm interpreting that correctly, that would be the answer. And if I'm not, please clarify. The next question is, how do we locate a DDA case manager if a child is approved for DDA services? Great question. Destiny, do you want to kind of talk about what the kind of intake and eligibility process is, and then how people get assigned to case managers, and then what they can do if they don't know who their case manager is?
Yeah, so what happens is when someone's made eligible for DDA services, they receive a letter in the mail saying that they are being assigned to the no paid services caseload. Basically, this means that the local office to where they live will have the file, it will be available, but they haven't requested services yet. It will also include a phone number that they can call that they can request services. So they call the number, they leave a voicemail with their name, their child's name, saying, you know, we're DDA eligible, we'd like some information on how to get services started. At that point, they will receive a call back from someone who will kind of discuss the general needs that they're looking for to make sure that DDA is the right service for them to be going through, or provide resources to the community if that is needed. And then they'll get set up with a case manager to do that very first assessment. If they are pretty sure, I've had a few times where I've had people reach out and say, hey, I'm working with this family. They're pretty sure they have a case manager. Maybe their case manager left and they're not sure who the new person is. Anyone can reach out to myself or even their local DDA office and just say, hey, I'm trying to find out if this person has a case manager. And if so, we can share that case manager's name and contact info. Of course, if we do not have a consent form and it is not the family member, that's really all the information we can share until we do get a consent form back saying that we can talk to this outside individual. But yeah, someone can always reach out and just say, hey, trying to figure out this person's case manager, and anyone can make a service request. It does not have to be just the family. We just ask in it that if it is someone else making the request, that they do leave the contact info and name of the person that we do need to talk to get things started. And I do see there's another question up here. Does Medicaid entitlement mean that every child on Apple Health with personal care needs is eligible for a CFC personal care assessment? So that is where it goes back to what I talked about. They also have to have that functional eligibility. So yes, a child who has Medicaid, even if they are not DDA eligible, can call the service request line and request an assessment. We have specialized case managers who will do that assessment because it's a little bit different than what our DDA qualified kids get to. It's not quite as big. And that will tell us if they meet the functional eligibility. And if they meet that piece as well, then they can qualify for the Community First Choice program and get personal care.
Great, thank you, Destiny. Another question came in. What are the disqualifiers for a parent to be a caregiver after the client or individual DDA services over 18? So the disqualifiers, there's background checks for all of our providers. So depending if there's certain types of things that come up on the background, some things are already identified as disqualifiers. Some may just require a review, which is called a character competency and suitability review. That we would then be looking at, does the individual provider have the character competency and suitability to provide supports to the individual identified. And there's also the piece of if an individual or a person wants to be an individual provider, a contracted individual provider with the state. It's also looking at the individual or client's assessment to make sure that the supports that are identified as the support needs for the individual, that the provider is able and willing to provide that level of support. That, you know, it comes up sometimes that, not a lot, but sometimes what's in an assessment or as an assessed need or an assessed support, an individual provider may not have the capacity to actually provide that level of support. And that would go for a further review to see if the person is suitable. Those are the only big picture. I mean, again, it's very person-centered. We'd have to make sure that we're looking at the individual we serve and the provider that's coming through. But those are if we're talking about disqualifiers, those are the only things that would be looked at that potentially could be disqualifiers. Hopefully that answered that question. Can you tell us about the new CPI for parents or others that would like to be caregivers? CPI, is that the same as the Consumer Directive Employment, CDE? So I'll leave that out there. Certification.
It looks like it.
Oh,
okay.
Gotcha. Sorry. Certification of parental improvement. It depends. I think it depends on what it says and what it entails, and we look at it person-centered and provider, individualized provider. What would be background disqualifiers? Oh goodness, I would have to look that up. I don't know that off the top of my head. And there's been some recent changes as well. I know that there's, I would have to look those up. You can find those because it used to be called on the secretary's list. It's not called the secretary is listening more, but it's usually pretty intense crimes, if you will. And also if licenses, if an individual has been deemed not to be able to have a license. I'm not talking a driver's license, but if there's been action on like daycare licenses or abuse, neglect, exploitation pieces that have come up. But as of specific background pieces, I would have to refer to it, because actually the backgrounds go through our background unit, or the state's background unit is processed, and those we don't even see the disqualifiers come our way. All right, any other questions? Oh, thank you. Thank you, Doreen. You are just on top of it. Thank you. All right, well, if there's no other questions, you know, again, my name is Terra Jacobson. I'm out of the Pierce office, and you know, you have Destinie Buzzard and Maria Bellarts. We are absolutely resources for you guys, and I will go ahead and put, let's see, I'll put my contact information in there. So if anybody wants to reach out and has any questions, feel free. And if Destinie and Maria could do the same. Thank you guys for today. I hope you guys got some questions answered. I hope you guys got some resources and links that you guys found beneficial. I hope you felt this time was beneficial. If you are having more questions specific to you, specific to a specific person, obviously we'll have to follow confidentiality and HIPAA, but we can always talk about process and what we could do or what next steps. We'd love to partner with you guys. I believe we're all in it for the same things that we want our community members to feel supported. We want our youngsters to be empowered at their young age, to feel safe and connected and have a support system that's just rallying around them to have a good quality of life, to make choices for themselves, and just know that people want them to be successful. So I believe that's why you guys are all here. That's absolutely why we're here. And we look forward to partnering with you guys. So thank you for this time. Thank you for being able to share our passion for DDA with you. And I'm sure our paths will cross down the road. So thank you.
And thank you. Again, this is Ashley Mangum, and I just want to thank all three of our panelists. You know, I've seen such tremendous outcomes come from our ability to come together and collaborate. So I appreciate you, Maria and Terra and Destinie, for sharing this. I know it's a large agency with a lot of moving parts. And so I think the more that we are able to educate and share resources, information, I think the better we will be as a community in whole. So thank you again to my panelists, as well as everyone who logged in today. We will send an email out with the resources that were shared today. We'll also link them to the Kids Mental Health Pierce County website, which I encourage you to check out for all things kids mental health here in Pierce County. Be on the lookout for future webinars and resources. And again, thank you again, Terra, Destinie, and Maria, and to all of our participants today.